We're going to talk about, can craniocervical instability or CCI cause sacral or tailbone area pain? So just to remind you, during this 6-week period, I'm going to be out and I'll be in Europe. Hence, my videos released during this time won't have a live Q&A. Almost all my videos do. But I will periodically jump on Facebook Live on Euro time zones during their day to keep up a few Q&A sessions. So we have a number of CCI patients that complain of low back pain or SI pain or sacral pain or tailbone pain. And if we look at all the different complaints that CCI patients have, lumbar pain is right in there. Now, it's not as obviously as common as something like headache pain or dizziness, but it is in the mix. And we know that a good chunk of those patients have pain in their tailbone, sacrum, SI joint area. So can these two things be related? Can the CCI be in some way causing this tailbone pain? And yes, because there are really two primary mechanisms. The first is direct irritation of certain parts of the spinal cord. And the second is that the lumbar stabilizers are turning off due to chronic neck pain. So one of the things that we see, and let me just grab a pen here, is that we have this lateral corticospinal tract and the lateral spinothalamic tract. Now we know the lateral spinothalamic tract is directly involved in pain. And we know that in certain types of CCI, like 2B, where you have C1-C2 lateral overhang, that the cord can get some pressure or irritation laterally. And look where the sacral and lumbar tracts are in the spinal cord. They're right there on the outside. So if you're getting lateral pain or lateral irritation of the spinal cord, that can cause these descending nerve fibers to get irritated. Same thing here with this lateral corticospinal tract. We can see again that the sacral and lumbar segments are exposed here. And we also know that low back stabilizers can go offline in patients with chronic neck pain. So these are two references that discuss how that happens and why that happens. Hence, there is probably a connection between craniocervical instability and chronic neck pain that can lead to low back problems, sacral problems, tailbone problems, all of that good stuff. Now, again, sometimes these are two different things, right? Sometimes we have sacral pain coming from the neck. Sometimes we have a separate sort of low back problem that has been caused by the neck stabilizers going offline. And that's why it's critical to get a good diagnosis here. So in summary, there is a mechanism for CCI to cause sacral or tailbone pain. In addition, many CCI patients have problems with their low back. So in those cases, sacral pain really isn't referred from the neck. And the next step always is to get a really accurate diagnosis, which then drives the treatment. So thanks so much for watching. Have a great day, and look forward to getting some more videos out there.